My daughter has JHD. Do you advise traveling out of state for specialized care? We would have to drive 10 hours to go to another center of excellence that has a JHD doctor.
Yes, I do advise going to the out-of-state COE. There is great value in being with a group of people that truly understand what HD, what JHD is. We've all heard the horror stories of families who have worked directly with their primary care physician who doesn't have that insight or doesn't have that experience. So there is great value. I will say I'm very familiar with Vanderbilt, who does a very good job of working with families and coming up with creative ideas. They will help them find local hotels at reduced rates. They will work with sponsors to make sure you're getting a stipend for if you're driving or flight or food. Really getting creative and listening to what families are reporting they need. Because if you don't tell us, we aren't aware of what you're going through. So I really encourage you, if you are in this particular situation, to advocate for yourself. Talk to your social worker, tell your doctors. Again, if you don't tell us, we don't know, and we want to provide the care that you deserve as a patient who has Huntington's or juvenile Huntington's disease. So yes, please go to your experts in the field.
Yeah. Thank you for that. And I know that Dr. Karen Anderson and Dr. Stemming, that I don't want to say you see a lot of JHD kids. I know you've been willing to see children with JHD. I know a lot of centers and doctors actually won't see JHD children. I think it has to do with the university and what they let people do. I think there's restrictions in that. So I think that's been a big talk and a buzz lately, is that they don't understand why a lot of times some of these JHD families are going to centers and they aren't able to be seen within the HD clinic. And I think that's really bothering them. There was just a show done that we caught last night.
Yeah.
It wasn't ours, it was another organization. And actually a JHD mother was upset that why can't our kids be seen at the Center of Excellence because they're children. So the reason why I say that is that I know that these two amazing women will see children and they'll email and they'll support I've gotten emails from Emily about children and Joey. And then obviously Dr. Stemming took a very, very hard case to help a family, but not everyone does. So please call the center that's close to you to make sure you see. And then I don't know if they don't, you guys think to keep expanding out? Or do you think just a pediatric neurologist would be okay if they're not seen in their area?
Absolutely.
I think a pediatric neurologist, particularly if there's one who's willing to partner up with a center. There are things that pediatric neurology and psychiatry know from their training that I would never claim to know. So if they're willing to partner up with a center and pull in some of the general HD expertise. Sorry for jumping on your comment, Erin.
No, I completely agree with you. And I think it's fair to say that we are all always open and willing to speak to providers outside of our area of expertise and outside of our state. And so, yes, if pediatric neurologists are even hard to find, much less pediatric neurologists that are familiar with HD, but we're really lucky that we have a pediatric neurologist that's on our team. But even if you can't get to a pediatric neurologist and you can only see your pediatrician, hopefully your pediatrician will be willing to reach out and ask for help. And again, I think we're all willing and able to provide guidance as needed.
Perfect. Thank you. Okay, Joey, you're up. Do you recommend any kind of day programs for someone with HD? Most of the people there are much older, and my husband doesn't really want to go, but I'm out of options for things to do while I work.
That is a great question. And I think also just a great example of the lack of resources for the HD community, especially when it comes to age barriers. We run into that all the time at our center, unfortunately. We usually recommend at our center adult day programs, maybe 1 to 2 times a week. If there's a community center that does different activities, or even we have some of our younger patients have joined local gyms that they've become really passionate about, that they spend a lot of their days at. It's obviously dependent on your loved one's disease stage and all of that, but it also is unfortunately dependent on location and what is available to you. Myself and Emily are always willing to help find a resource. If we don't have the answer, we will search for it and hopefully find the best option for you. But I think ultimately what I've learned most from the HD community is how creative families and individuals can be when it comes to getting the resources that they need. It's unfortunate the lengths that this community needs to go to, but it just shows the resilience. So I don't have a clear-cut answer, but I think just getting creative and seeing what's out there. And again, connecting with your COE, and I'm sure the social worker would be more than happy to assist in finding that resource.
Yeah, thank
Great,
you.
thanks. For Erin, is it common for someone that is a teenager to show signs of HD, but not have JHD?
Really good question. Let me just start by mentioning that I have three teenage boys, and two of the three are probably still asleep, which is why I'm hiding here in my office. I think it's fair to say that teenhood, if you will, is an interesting and challenging time, to say the very least. And we know that there are hormonal changes, continued neurodevelopment that's occurring in teenagers. And this can contribute to irritability, fluctuations in mood, sleep disturbances, and these are all considered within normal limits, whatever the heck normal actually is, of course. But there can be changes in mood, and there can be behavioral, neuropsychiatric features that our teens experience that are not due to HD or JHD. We know that anxiety and depression are common in the general population, but we also know that there's data to support that individuals that are raised in an HD family may have increased rates of anxiety and depression and other psychiatric symptoms. And I'm sure Dr. Anderson can also elaborate on this. So it is possible to have behavioral disturbances as a teen and not have JHD. That being said, we know that behavioral disturbances can be part of JHD. So I think if you notice that your loved one is experiencing a change in their behavior, some concerning symptoms, and importantly, there seems to be some degree of regression, maybe at school, or having more trouble at school, it is absolutely appropriate and important for you to discuss this concern starting with a pediatrician, and then ideally, if you have an HD care team, to discuss these concerns with your HD care team.
Yeah, absolutely. I think also us as moms, when we have children at risk, we watch them so close. Like you tell yourself, don't watch, we're not there yet, but you can't help. And every time they spill the milk or they trip over their words or something, as I just tripped over my words, and I'm not at risk for Huntington's, right? But as moms, we watch our kids. And I think that when my friends that their children are now diagnosed, they reflect back on that watching and think of those times of that spilt milk or that trip on the soccer field. And they think, did HD start at that time? Or was that, like you were saying, Erin, just being a teenager and not knowing your height and being clumsy? And I guess that's really hard to know what it was.
Yeah. Absolutely. And I think, Dr. Anderson was going to say something, so I don't want to interrupt, but I hear this often from the moms that or the parents, if we have an affected parent with HD and their child is at risk, and they're absolutely watching every move and analyzing every if there is a stumble and trying to determine, is this JHD? That is normal. I think it's really important to respect a mother's instinct. And so sometimes we'll evaluate kiddos, we'll have our pediatric neurologist evaluate kiddos and just follow them longitudinally. And because there are even though HD is of greatest concern for these parents, there are other things that could be going on, other sleep disturbances that are maybe not under the umbrella of normal teenage development that can be addressed and treated, and again, may not be due to JHD. Sorry, Dr. Anderson, I think you were going to say something.
I was going to add, I don't want to minimize the concerns that people have. They have a child who's at risk. On the other hand, particularly for psychiatric symptoms like depression, anxiety, sleep disturbance, irritability, those are so common in teens that sometimes I feel like parents get very hung up on wanting to get someone tested when they're 14 or 15, where, specifically for psychiatric symptoms, we would treat those the same way, regardless of whether or not somebody is gene positive. So the information from doing genetic testing early on somebody before they're 18 probably wouldn't change our treatment for those particular symptoms. And might take away the child's freedom to decide later on whether or not he or she wants to be tested. So I think it's important to look at what the symptoms are, what the treatments would be. Would testing for HD at that point actually change anything? Or is it a matter of treating what's in front of you, getting the child on the best track possible, and then when he or she reaches 18, thinking more about testing at that time?
Thank you, Dr. Anderson. Our next question is for Emily. I cannot find anywhere that will take my sister for care. They say she's too young. And I believe we talked about this, a care facility. They say she's too young. Any suggestions? Also, can I do anything as far as lawyers are concerned for age discrimination, which is interesting, discriminating the opposite way, right?
This is a tough crowd. These are some really difficult questions, but I appreciate all of them. I'm glad they're being asked. Unfortunately, this is a very common situation that I face very often with families. And I think we have to take into account with nursing facilities that a lot of nursing facilities are very understaffed. So if they're understaffed, they can't provide the hands-on assistance that is needed for many of our population, especially end of life, or if there's a history of suicide attempts, or if there's a history of falls. Nursing facilities get penalized every time a patient has a fall. So if we have an individual that's falling 5 or 6 times a week, that can be very problematic for a nursing facility. I will give an example. Last year, I had a patient and a family member that I worked with. I called over 37 nursing facilities until we actually found an appropriate situation for them to move into. And initially, the poor wife was attempting the calls on her own. Thankfully, she reached out to me, so I was able to support her in calling all of these facilities, because it does take a toll, and you do start thinking about age discrimination, and this isn't fair. Why is it happening to me? Why won't they just accept my loved one? So it really is a balance. I have had recent success with using Oasis Senior Advisors. Just another layer of support. They're a team that can go out and work directly with, say, if a loved one is in a psychiatric unit at a hospital, they can work with the unit and go through all of the medical clinical notes and pair them to an appropriate facility that is staffed, that is willing to accept the individual with HD. So very important, I think, having an understanding or a perspective that it is challenging finding a nursing facility, and going in with an open mind really helps, and being willing to accept help of having your social worker or having an outreach coordinator to make those extra calls for you.
Yeah, and when I used to work in care homes, there was something that, and this just reminded me because of the age discrimination part, where everyone's, whatever kind of facility they are, they're licensed for exactly what they're doing. And that's what makes it so difficult. So a lot of them are licensed to care for people who are, say, 62 years and above. And they have a range of ages that they can take care of. But there are things that are like a waiver, and they can allow 2 waivers per facility, but it has like a lot of application process and time, and sometimes we don't have that, but there are sometimes options. But that's usually like the wall, not like that can be put up, is simply that they're not allowed to take care of people of a certain age. And that's what we used to run into all the time when I used to work on like the opposite side of that. And we would have to put in a lot of paperwork to try and make it work for families. So just for another view. Yeah.
And there are HD specific nursing facilities. With our location in DC, the closest location with a nursing facility with an HD wing is in New Jersey. So that's asking a lot for a family to move their loved one all the way to New Jersey. So there are those opportunities, but again, it's a balance. I will say we have had recent success working with facilities that have experience with Parkinson's disease, just because a lot of times they are accepting Parkinson's patients that are in their 40s or in their 50s, and they are better staffed. I think a couple years ago, the recommendation was to have them move into a memory care unit, which yes, that is an option, but it's a balance of knowing your loved one, knowing if it's going to be appropriate or not for them to move into a facility like that.
Yeah, that's a hard one. Next question's for Dr.
Well,
Anderson.
I have a
Oh,
question.
I'm sorry,
actually.
I'm sorry.
Comment. I have a comment. First, I think it's really important to let the facilities know if your loved one has been working with an HD center, that the facility will have the center available to them. So if there's a concern about behavioral symptoms, because that's usually the big one, or how to manage someone with HD, there's all the expertise at a center, and we're all available to the facilities. And then Joey and Emily, I wondered if you wanted to talk for a minute about the in-services that you offer also, because that's something else that some centers are able to do.
Yeah, again, like Dr. Anderson mentioned, it's again so important to let the facility know that the care team is available for questions or concerns. And then Emily and I also will go to facilities, see the facility firsthand, and provide education on HD to the staff. We've had a really positive experience. Staff is very engaged, and it also just shows the lack of HD knowledge, I think. And so us being able to go and provide that education is an additional layer of support for families and also the staff, which is extremely important for loved ones and receiving the best care.
That's awesome.
And I'll add the in-service we did, we had over 20 staff members present for the in-service, and it was the most interactive in-service we have ever done. So it melted my heart, the fact that so many staff members wanted to learn more about HD. We educated that many more people. I will be honest, I probably received 2 or 3 emails or calls from the facility asking for help, but we embrace that. We love that. We're willing to work with facilities because they have questions. A lot of times they're doing what they need to do. They just need that reassurance that yes, just because a person has HD, they're still a person, they're still a human. They still need that genuine contact and care that they deserve.
And we just had a message, and it's so funny. It's how far will you go? And I'm like, okay, they're in DC, like they're not because this is actually like she lives in North Carolina. I know where she lives. But it makes you go, I'm like, oh, that's so far. And then it makes you go, no, with Zoom and all this new technology, when you have really good social workers are really hard to find. And in the HD space, especially, we get a good one and they leave. It's very common. And so we have the really good ones. It's, hey, can't you guys come together and do a program of in-services virtually for those places? That would be really, yeah, important, like for you guys to do something like that with all the time you guys have. Do a whole bunch of Zoom in-services for care facilities. But I think it would be important, and I think it would be really helpful for the communities in those areas that they don't have the Emily and the Joey, they don't have the social worker and the coordinators to help them, for someone farther away to come in. I think that would be really awesome. It's something.
And I think you have to think about the experience of the staff also. If you're used to caring for older people and you accept someone older needs to live at a facility and it's the end of their life and they've had a good life, it's very different caring for a 30 or 20-year-old. Maybe they're the same age that you are, and seeing someone who needs that amount of help, who can't be with their family, who may have outbursts. It's really important for the day-to-day staff to have people like Emily and Joey that they can talk to, that they can voice their concerns, or just what it's like to take care of someone your own age. That can be a really difficult thing for people.